Well, good day to you. This is Greg Downing with Texas Medicare Advisors here in Austin, Texas, and I'm a licensed insurance agent specializing in helping people sign up for Medicare and get the right Medicare supplement plan at the right price. Now, if you're like most of my customers, you are confused. This whole process is just overwhelming. The more you read, the more confused you get. So I'm going to break this down at a very high level on exactly what I would do if I was signing up for Medicare based on helping hundreds, if not thousands of people go through this process. So let's start right off the bat with what do you got to have? Well, you have got to have Medicare Part A. Medicare Part A, that's your hospitalization care. The good thing about this is it's free for most people as long as you've basically worked 10 years to get your 40 credit hours or your spouse has. Now, Part A, while it is good coverage, it does have a deductible of $1,556 every time you're admitted to the hospital. So that means if you go in January, then you got to go back in May. You're going to have to do that twice. So that's exposure I really don't like to have. In addition to that, for whatever reason, and I frankly don't know, you have to pay for your first 3 pints of blood. And I'll give you a little ticket tip here. It's more expensive than beer. And a lot of people also don't know that if you're in the hospital for an extended period of time, you could have daily copays up to $778 a day. And if you're unfortunate enough to be in the hospital for more than 180 days, there's no coverage for you whatsoever. All right, so that's your Medicare Part A. Now, what else? You got to have your Medicare Part B. This is your doctor visits, preventive care, ambulance services, also covers chemotherapy, medical durable equipment. Now, this you got to sign up for. It doesn't happen automatically unless you're already drawing your Social Security benefits, and they will sign you up for your Medicare Part A and B, and you don't have to do anything. But otherwise, you're going to need to go online, create an account at Social Security, and sign up for your Medicare Parts A and B. Now, most people are going to pay a premium for this. It's not free. It's $170.10 a month this year. Now, if you're a high-income earner, you may be required to pay more because you know our government, how they work. The more you make, the more they take. So if that's an issue, we'll talk about it, but we'll just assume that everybody's under $188,000 and they're paying $170.10 a month for their Medicare Part B. Okay, in addition, there is a $233 deductible for 2022, and you would be responsible for that. And then after that, Medicare Part B is going to pay 80% and you're going to pay 20%, which sounds pretty good if you only have like a $200 medical bill. But what happens if you get cancer and you have to pay for chemotherapy and you got to pay 20% of that, and the average cost for chemotherapy might be $50,000 or $60,000. That's a lot of money out of your pocket. So these are exposures that are unacceptable to me and most of my clients. So what we do is we get what is known as a disappearing van. We get a Medigap plan or a Medicare supplement plan. It's the exact same thing. It's just two different names for the same thing to make this even more confusing. All right, what is a Medigap plan? Well, it pays for those things that Medicare doesn't cover. For example, your Medicare Part A deductible, that $1,500, it pays for that. Your co-pays, and it pays the Medicare Part B 20%, so you don't have to. Additionally, pay for your 3 pints of blood if you need that. The only thing that the best Medicare gap plan doesn't cover, that would be a Plan G, is $233. That's the deductible for Part B. There's nothing that you can get that's going to pay for your Medicare Part B. But with this route, you get your Parts A and B, you get a Medigap plan, and essentially you have 100% coverage other than that $233 deductible. All right? Now, that takes care of your hospitalization and your doctors. But remember, now we got to get a prescription Medicare Part D plan. Now, how do you know how to get these? Well, believe it or not, there's 26 different plans to choose from. And the only way you're ever going to know which plan is right for you is if you'll just give me your prescriptions and what pharmacy you want to use. I'll put them in their magic system, and it will spit out which plans are best for you based upon your particular medications and your favorite pharmacy. All right, so that's the way we do that so that you're not overpaying for your prescription plans. And these run anywhere from $6.90 up into the 80s. Now, what if you don't take any medications and you say, I don't need no prescription drug plan, can't take anything? Well, you still want to get one, because if you don't, you're going to accrue a penalty when you do get one, and it can be very expensive. So even if you're not taking any prescriptions, you still want to get at least that $6.90 plan so you stay in compliance. All right? Bingo. Now, the other thing that I will hound on you about is that you must have a long-term care strategy or a plan to take care of you when you get older. Why is that? Because Medicare does not pay for your long-term care. And the reality is, studies show us that 70% of us will need some form of long-term care once we hit 65. Now, if you'll see that good-looking man right there, that's my dad, Johnny Lee. That's a picture of him at the Age of Central Texas, which is an awesome adult daycare center that I took him to every day while he was living with me. Now, prior to that, he lived with me the last 4 years of his life before he passed. And prior to that, he and my mom were in assisted living in Lubbock, Texas for about 2.5, 3 years. Now, I'm going to tell you that is all very expensive to get all that taken care of. Now, he did not have any type of insurance. Luckily, he had a little bit of money, but we spent almost all of it just trying to take care of them. So I urge you, and a lot of times people will say, well, our financial advisor tells us that we have enough money to self-insure. Well, I would challenge him or her to put that in writing in an email. Guess what? They're not going to do it because we can't predict what the cost of long-term care is. Number one thing that can delete all of your savings is if you need long-term care and you don't have some policy or program in place to take care of it, can bleed all that down. So don't put that stress on your spouse, your family, and I'm certainly not going to come take care of you. So just think about that you need to have some type of long-term care plan. And part of our process is we share you some options of how you can do that. Whether or not you participate in it, that's your choice. We just want to educate you and let you know the options that are out there for long-term care strategies. All right, enough about that. One other thing that Medicare doesn't cover, well, they do cover cancer, all right? But additional coverages that I recommend is get a little cancer insurance. Now, why would I say that if Medicare covers cancer? Well, the average for people, the majority of people who get cancer are over 60. All right, so that's like 60% of the people that get cancer are over 60. Number two, there's also medications that are very, very expensive when it comes to treating cancer, and these can be $6,000, $7,000, $10,000 a month. And even though you have a prescription drug plan, if something costs $10,000 and you still have to pay 5 or 10% of that, that's a lot of money. In addition to that, the doctors may want you to do certain things that maybe Medicare doesn't cover. Or it's just the cost of travel to go to MD Anderson or whatever it is. So I just recommend you get a little cancer insurance just to supplement that in case that happens. The other thing Medicare doesn't cover is dental, vision, and hearing. Ooh, that'll make you dizzy. I didn't know that he did that. All right, so those are additional coverages you can get. If you want to talk about those, that we're more than happy to help you with that, but those are things I also recommend you look at. Now, if you'll do this, follow this checklist here. You get your Medicare. Parts A and B, that's what you got to do. You get a Medicare supplement plan or Medicare gap plan, either a G and N. We'll talk more in detail about that. Decide what additional gap plans you need and start thinking about a plan for your long-term care. Now, with original Medicare, a supplement plan, and a prescription drug plan, you're able to go to any doctor in the country without a referral as long as they take Medicare. You're in charge of where you go, what gets done, as long as they take Medicare. All right, so this is exactly what I would do if I were turning 65 today. Now, you've probably seen this commercial a million times, if not once. What in the world is Joe Namath talking about free benefits you get or you don't have that you deserve? Well, all these commercials are geared around Medicare Advantage plans. Now, what are Medicare Advantage plans? Well, a Medicare Advantage plan is where the government has contracted with Aetna, Humana, name whatever insurance company, to provide you a plan that looks and smells like original Medicare, but it's not. It's managed care, and it's provided to you by a privatization of Medicare, either through an insurance company. So some people like these plans, some people don't. There's advantages to both of them. You can look at the chart and see majority of my clients prefer to go with original Medicare, so they're in control, but some people need to go with a Medicare Advantage plan based upon their finances. So these are the differences. You can look at them. We talk about them more later, but that's what's all on TV and all the mail you get. They're driven towards the Medicare Advantage plans. All right, so that's a very high-level view of what I would do if I were signing up for Medicare today. So just give me a call, 512-656-9378. That's my cell phone. You can get a hold of me, text me, and let's set up a time where we can get all this stuff knocked out, handled, and you can move on, get transitioned to Medicare, and your life will be so much easier. All right, God bless. Have a beautiful day, and I look forward to talking to you soon.